Today we're talking about the basics in regard to the menstrual cycle and ovulation. So first things first, as a fertility doctor, and what we want you to know is what's our alphabet. And our alphabet is your menstrual cycle. So the first day a woman bleeds, that's cycle day 1. Okay, the first day of her period is cycle day 1. And my alphabet is it's typically about a 28-day alphabet, 28 days. So the first day she bleeds is day 1, the second day is day 2, the third day is day 3, the next day is day 4, 5, 6, 7, 8, 9, 10, 11, 12. So we keep counting all the way until the next menstrual cycle, so the next period. And that's important to know because we may ask the woman to do something on cycle day 21 or cycle day 14, and it didn't matter how many days she bled, but we just start the clock. We start counting from day 1. If you have to wear something, if you have to wear a pad or a tampon, that's day 1. If you just have to wipe, that's not day 1. There's an argument, you could use both, but I like to say if you have to wear something, that's day 1 of your cycle. Then the next day is day 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, to get pregnant, to help couples get pregnant or to know more about ovulation, typically the woman ovulates around the average woman will ovulate around day 12 or 13. And what we recommend is a urine ovulation predictor kit, just like the cheap, that Walmart 20 LH or ovulation predictor sticks. You can get like 20 sticks for 20 bucks at Walmart, something like that, or online at Amazon. Start dipping the urine for LH, start dipping for ovulation around cycle day 9 or 10, and dip the urine once a day. And when it turns positive, that means you're going to be ovulating the next day or the day after. So when it first turns positive, we recommend stop testing and have sex that night for 3 nights straight. There's arguments to this. You don't have to have sex every night. It could be every other night. But we think that really targets ovulation properly with sperm if you want to get pregnant. But from when the urine test first turned positive, sweet 16 days later is the earliest to check a urine pregnancy test to know if you're pregnant. Even if you bleed, you need to check your urine pregnancy test. You know, we're all brainwashed that bleeding means I'm not pregnant. Folks, that is not true. A lot of our patients are pregnant and they will bleed because it's implantation. The pregnancy is implanting, and they'll think they're on their period and they're not. It's just actually implantation. So if you're really into it, you really need to check a urine pregnancy test every month, 16 days after the urine ovulation predictor kit first turns positive. Sperm can stay in the egg is only fertilizable for a day or 2. There's debate about that. And don't get bogged up in that science, because when sperm's in the body, the sperm can stay in the body up to 6 days. And we want sperm in the body before the egg comes out, not like common sense would tell you to have sperm in the body after the egg comes out. You need sperm in the body before the egg comes out. There's good science proving that. And anybody wanting to get pregnant, you need to be on folic acid, at least a minimum of 400 micrograms. We just generally tell you to take a prenatal vitamin that has enough in it. And the new thing is a low-dose aspirin, 81 milligrams of aspirin. Take it every day, and then when you're pregnant, you'll stay on that, and it helps decrease your risk of preeclampsia. So a prenatal vitamin, or just as a minimum folic acid with a low-dose aspirin, what we used to call baby aspirin, 81 milligrams of aspirin daily. So those are the basics, and that's a great way to do this. The urine ovulation predictor kit's very robust. It's better than the basal body temperature charting. This is the way to get pregnant at home.